AUM News Zoom room. Hospital Administrator Lillian Posadas joining the show. Good morning, Lillian. Thank you so much for joining us. We know you're really
Oh,
busy.
hi, Lillian.
Good morning.
Good morning.
Hi.
Mm.
I don't know if your ears were burning earlier, but Dr. Akimoto was talking about you. Had some good words about when you show up, you go to the ER, you do nurses things. So I just wanted to let you know that we had some people speaking very highly of you this morning.
Thank you. We're here to do our work.
Well, let's get right into it. I kind of want to start with the sixth COVID-19 fatality. So tragic, even more tragic, that in many ways, this man's death was overshadowed by the results that we got last night, and then the ensuing information that we were going to be going into a strict lockdown at noon. So we'll just start there, Lillian. What do you know about this sixth fatality, and what can you tell us?
Well, it's a male individual in his 70s. Apparently was, found by the family unresponsive and breathless. And so he was brought to the emergency room at about 5:14 in the morning. And, our protocol is that any individual who comes to our ER will get swabbed, whether the individual is alive and, or is an expired, individual. So he was swabbed, and that's when it was discovered that he tested positive for COVID.
I know there was
He was
some.
not
Go ahead. Go ahead.
he was not known to have COVID. At least that's the history we received from the family that he was not a known COVID positive individual.
Do you know if the man lived alone?
No, he has family.
Okay. And then, so I saw that there was some discussion about whether or not this is classified as a COVID-related death.
Okay. Well, it has been determined that it because of the positive COVID test, so he's definitely a COVID individual.
Right.
Whether the COVID infection was the cause of death, that has yet to be determined by the emergency room doctor. The individual was already expired, and so cardiac arrest was the most appropriate decision when he was brought to the emergency room. He was pronounced because he was pulseless, he was breathless, and so he was pronounced. And the primary cause of death was the cardiac arrest. But because we tested
Right.
the individual, it came out to be COVID positive. So I think it's reasonable to say that it is a COVID death.
Sure. Lillian, what's the protocol? So you have this man come in, uh, you know, uh, test positive for COVID. What happens after that?
Well, the latest guidelines that we had been following from public health was that anytime an individual expires a COVID, with the COVID infection, 24 hours, within 24 hours, the remains will need to be buried or cremated. I connected with the arts and I was seeing yesterday, and apparently there's been some changes.
Hmm.
So I need to follow up whether or not we still need to bury or get that body, the remains over to the funeral home.
Yeah, we'd done a story on this earlier this week, and public health didn't know that the guidelines for dealing with the COVID the fatalities had changed. So you're right. There's some new. It's up on the CDC website. Lillian, everyone's talking about hospitalizations. We saw an increase. We're at 17 now. So could we just go through the numbers and the status?
15.
16.
Our
Okay.
numbers are 15. What we
15.
have in-house is 15.
Okay. So go ahead if you could just give us the stats and the numbers. COVID-19 at the Guam Memorial Hospital.
In Care 2, which is our ICU level of care for COVID individuals, there are 4 individuals in there. 3 of them are on ventilator support, meaning that they are on mechanical ventilation support. The 4th individual in Care 2 is still a ICU level of care, but it's not intubated, not on a ventilator, is receiving though supplemental oxygen through continuous pressure, CPAP is what it's called. The remaining 11 individuals who are up on Care 3, that's our fourth floor COVID unit, um, some of them are on high flow nasal cannula, supplemental oxygen. Some do not need the oxygen. They're on room air and they're maintaining their oxygen saturation level over 92%. Some of them are on just the simple nasal cannula, oxygen nasal cannula. So, that, and they're stable. All 11 of them are stable.
Lillian,
We
what?
had 3 admissions during the night.
Okay.
You had three what? I'm sorry.
3 new cases, 3 new admissions into Care 3.
So,
Bringing the total to 15. Right.
Yes,
okay.
15.
So Care 2, 4. So there's only one bed left available. Care 3, there are 11. And I believe you said there were like some 20 beds, so you're half full there.
The Care 3 unit has a capacity of 17 beds.
Oh.
And so right now, 11 are occupied. We're also in the process of moving all those 11 patients down to what we're converting as Care 4, which is our medical telemetry unit in third floor. We're moving all those patients down there because it does have that, central cardiac monitoring capability, telemetry. At the same time, there are some rooms there that can accommodate progressive care unit level of patients, meaning those individuals who are close to going to ICU but are at that mid level there in between telemetry and ICU. It also has the capacity to accommodate ICU level of care patients. So those 26 beds is going to be a combination of telemetry, PCU, and ICU. In the Care 2, yes, we have a capacity of 5 beds, but because 3 of them are on ventilator, it really makes it very tight. So we're right now limiting it to just 4 in that Care 2.
Lillian, we had Dr. Cabrera on earlier in the show, and he had said something about hospitalizations are up, but the length of stay is
It's
shorter,
longer.
is longer.
Well, some are longer, like the ones in Care 2. They've been here a while. There are some new admissions who are not needing to stay longer, just short term, and then they're discharged to the government isolation facility for continuation of their isolation needs.
Okay. And
It's a
so
varies.
all right. So Care 4, you guys have already started making moves with that unit.
We've cleared out those patients. We've decompressed it.
Okay.
We're getting it, prepped, decontaminated, prepped, and making sure that everything is ready, good to go.
What about the SIF at SNU?
That again, what's delaying us is the chiller. The
Okay.
25-year-old chiller that got repaired is working. It's just again, like I said previously, it's not really. It is keeping the facility cool because it is empty. But if we put in patients, then
Right.
then the temperature right will not be as comfortable. But the donated chiller, we were hoping to get the any the design from the vendor that was selected from that RFQ. Unfortunately, we're not going to do that. So now we have reached out and requested for the GUN, the Army National Guard. They've offered, they've extended, and so they're now looking at assessing the area, what they can do, what needs to be done, because we need to continue the existing chiller to run while we're getting the donated chiller installed, with a little bit of a construction to get it secured in place, and then get it commissioned to run. Once it's operating, then definitely, we can occupy that facility.
How many beds are at the SNU?
At SNU, it is physically structured for 60 beds, but we brought it down to 54 because we need to make sure we have storage for, equipment, such as if we need the ventilators, they're going to be there in some of the rooms, and other medical equipment.
So what's the new target deadline to get it open?
Oh, gosh. Like I said yesterday,
Yeah.
but, we're just going by we don't have much of control with a lot of things. So
Right.
now with the National Guard into play, hopefully we can get it by next week.
Hooah! Let's go, guard.
Uh,
Yeah,
what about staffing? I know that Dr. Cabrera said the ask was made to the military. Can you
right.
provide an update on like how soon we're going to see some military personnel helping out, and are they going to be helping out at GMH?
See, I don't have information on that one. I'm going to be, hopefully, when we have the ops meeting this morning at 10, I'll get more information.
Right.
But, we're also looking, and I know Superintendent John Fernandez was just speaking before I came on, and he was talking about the nurses, the DOE nurses, that he's been in communication with Arts and Augustine, because they need help there too. But if at all possible, because there are some school nurses who currently work with us here at the hospital on part-time basis. So if we can again get those five school nurses back into the hospital, that will be a great help. And if any other of those school nurses would like to, get their skills in hospital nursing practice, that will be great. We'll mentor them, we'll coach them, we'll, go side by side with our seasoned nurses so that they feel confident and that they will be successful in getting their hospital nursing skills back again. We'll be glad to have that. So I'm going to be setting up a meeting with the governor's chief of staff, John Powell, and we're going to set up a meeting with Superintendent John Fernandez.
Right, Lillian. I know
See how
you said you had been in a meeting this morning. Can you tell us anything about that meeting that you were in this morning?
It's a different meeting, separate meeting from this.
Okay.
So, yeah.
And then logistically, just real quick, when you talk about moving COVID-19 patients around the hospital, what does that entail? And moving them through. I mean, do you have the PPEs and all that stuff?
Well, medical telemetry right now, that's on the third floor. And I'm trying to remember if there were TVs in that room, because we've had TVs donated. So I was going to do a walkthrough up on the third floor. I haven't gotten there, but I will hopefully today. There may be some televisions for the patients to then be entertained, and I'll verify that.
No, I
But
think
just
he
Yeah,
was.
yeah. I was well. On that note, can you just put all the televisions on KUAM TV8? Thank you. No, I was saying when you move the COVID positive patients around the hospital, what does that entail logistically? Because obviously highly contagious, right?
Right. We keep them in we call it demystifier. So there's plastic containers that they are covered with. So that way, again, we minimize any kind of a spread infection. We have a protocol that whenever we're moving these COVID patients, overhead announcement, transfer 19, meaning people do not come around to the elevators.
Wow.
They just stay away, and that way we get that patient moved from one area to another area in a contained plastic, barrier,
Right.
so that there's that minimizing of, the spread of infection. We got this down pat.
Right, right.
Anything else you needed to get out?
Again, continue, please, everybody continue to heed and, work in unison with what we're trying to do. I know there's been comments about us not being prepared, but we really are prepared as much as we can, given our resources. These patients are getting taken care of, to the best of our staff's ability, and we are trying very much to minimize the spread of infection. Everybody's on board, and so we just need to continue working together, not against each other. I mean, if you're going to disagree, okay, fine, we disagree respectfully, but to continue these criticisms and fighting us and working against each other, that's not helpful. Let's come together with ideas, and if you disagree, we respect that disagreement. But to have all these attacks, it's not helpful.
Hey, were you consulted with the purchasing of those tents? I mean, from a nurse standpoint, because I don't know if we asked it. Are those feasible, practical?
There's been discussions from the beginning, but I haven't really given my input in terms of, because the concern I have is, yes, it'd be great to have those tents, but we need staffing.
Yeah.
Okay.
Okay. Thank you.
All
Thank you.
right. Thanks a lot.
Thank you, Lillian.
Thank-
And
thank you, too.
yeah,
Take
keep us
care.
posted, and God bless you, okay?
Stay safe.
Stay safe, please. 9/11. The link. Yeah, we're going to go to, we'll keep it in the Zoom room.